Health experts have voiced a deep concern over the escalating prevalence of non-communicable diseases in Uganda, citing factors such as increased alcohol consumption, unhealthy diets rich in oils and sugary drinks, tobacco use, and physical inactivity. The issue was highlighted during the launch of the DCAD project aimed at combating non-communicable diseases like diabetes and cardiovascular diseases held at Kamukira Health Centre in Kabale Municipality. Dr. Frank Mugabe, the principal medical officer in the Ministry of Health Department of Non-Communicable Diseases, revealed alarming statistics indicating that diabetes cases in Uganda have more than doubled over the past decade.
Diabetes has more than doubled in the last 10 years. Much as the burden of hypertension may have remained stagnant, but it's also very high. Out of every 10 people, almost 3 have hypertension, and out of every 100 people, about 5 have diabetes. But you know, these are chronic diseases. Once you get down with them, it means it's forever. You have to be on medication, you have to be spending money, you have to be going to hospitals, and they lead to other serious complications like strokes, heart failure, kidney disease, amputations. People lose work time, people spend and sell their property. So it's important that we emphasize prevention, early screening, and early treatment so that we are able to stop these conditions. For Kabale, I've particularly highlighted the issue of alcoholism. There is too much alcoholism, all sorts of alcohol. We need to reduce alcoholism. I've also highlighted the issue of unhealthy diets. People have moved away from eating vegetables, the dodos, the bishusha that we used to eat. They have moved to more of eating oily and fried foods and sugary drinks, which are quite dangerous. There is still a lot of tobacco consumption and some pockets of tobacco growing. I've also highlighted that. Then the issue of physical inactivity. We have nice hills and semi-mountains that we can climb as alternatives to moving on motorcycles. We have our bicycles that we can ride so that we keep healthy. We have our gardens that we can attend to so that we keep healthy. Yes.
He stressed that among every 10 Ugandans, Dr. Mugabe attributed to the rise of non-communicable diseases to widespread adoption of unhealthy lifestyles, including poor dietary choices, lack of exercises, and excessive alcohol and tobacco consumption. Represented by the district RDC Godfrey Nyakauma as the chief guest, Dr. Alaru Charles, the director of clinical services at the Ministry of Health, emphasized the global and national threat posed by non-communicable diseases, noting a substantial increase in the diabetes prevalence globally. He underscored the urgent need for effective interventions to curb this trend, given the rapid changes in the lifestyle contributing to the rise of non-communicable diseases.
Non-communicable diseases are now a global and national public health threat. The prevalence and mortality due to non-communicable diseases has persistently continued to increase, not only in Uganda, but globally. Globally, the prevalence of diabetes has nearly doubled since 1980, rising from 4.7% to 8.5% in the adult population. This alarming trend is mirrored in Uganda, where diabetes affects up to 3.3% of the population. These modifiable risk factors contribute significantly to the burden of non-communicable diseases, which currently account for approximately 33% and all reported deaths. They predispose individuals to diabetes, cardiovascular disease, and other non-communicable diseases, exacerbating the public health challenge. To address this increasing burden of diabetes and cardiovascular diseases, World Health Organization launched the Global Diabetes Compact in April 2021 with the aim of bringing all stakeholders together in order to make countries, communities, and health systems worldwide able to prevent and control diabetes and cardiovascular diseases efficiently and permanently. This compact provides a unique opportunity to address the above-mentioned challenges. Its overall goal is reducing the risk of diabetes and ensuring that all.
Dr. Gilbert Mateka, the Kabale District Health Officer, welcomed the DCAD project as a critical initiative to enhance the district's capacity in managing non-communicable diseases. He reported a significant weekly influx of new cases of diabetes and hypertension in the district and emphasized ongoing community health education efforts aimed at reducing non-communicable risk factors.
This is a very good project that is coming to support the health facilities in both prevention, screening, and treatment of these patients. We want to make sure that all our patients that come through are given good services, but also reach out to the communities to see how best to educate the communities to be able to prevent the increasing burden of non-communicable diseases. So this project is most welcome in Kabale. We are very excited that we are among the few districts that were selected in the country, and we pledge our commitment and support as health workers to make sure that it is successful, especially in benefiting our patients. We have identified, the project requires that we identify up to 10 health facilities to be able to implement this project that will be compared with other control sites where we may not be having the interventions. We continue to health educate our communities on all modifiable factors that cause that increase the risk of our population to acquire any of the non-communicable diseases. So,
Andrew Nangoli, the project manager for the Global Livingstone Institute, highlighted the significance of the DCAD project, noting its implementation in Ghana and Uganda as a pilot study. He indicated the project's potential for expansion to the districts based on its outcomes, supported by $1.36 million investment from partners including the World Health Organization and the World Diabetes Federation in the collaboration with Kabale District local government. The 4-year DCAD project aims to bolster efforts against non-communicable diseases in Uganda, focusing on enhancing health care services and community education to mitigate the growing burden of the chronic diseases. Samuel Omuza, ABK Television.